Okay. Um, Good morning, good afternoon, good evening, everyone. And I'd like to welcome you all to our webinar on state citizen dynamics of trust through COVID-19. I'm absolutely delighted to be able to host this event today. My name is Shandana Khan Momand, and I am a fellow in the governance cluster at IDS. And I'm going to introduce all of our speakers in a moment. But before I do that, I'd like to extend a very warm welcome to our audiences who are on YouTube and who will be able to join us for the question and answer session by posting their comments on the YouTube comment box. If there's any on Zoom, they will also be able to join us through the chat function. But I'd like to just invite people to also tweet the event through the IDS Twitter handle, which is at IDS_UK. I'll put that up on the screen in a second. And we also wanted to let everyone know that this event, this webinar will be available after the event on the IDS website and on YouTube. Before I go to the speakers, I'd like to just quickly introduce the IDS hubs. This webinar was organized in collaboration with key partners from our Pakistan, China, and Brazil International Development Research and Mutual Learning hubs. These hubs aim to intensify and extend our collaborative research, teaching and mutual learning activities in key locations of strategic interest and importance in the global development landscape. Information on these hubs is available on the IDS website. And we're really excited to be hosting what we're hoping will be the first of many cross-hub conversations that in which we will be able to learn on experiences and learning from these countries. So let's jump straight to finding out who our speakers are today. I'm going to share my screen, put up their names very quickly, and hopefully this is visible to everyone. We are being joined today by Dr. Yi Chai, who is a lecturer and research fellow at Wuhan University Global Health Institute in China. We're incredibly excited to have her with us today because she's been doing research on public health for a while, but recently after COVID-19, her policy briefings have been used as part of government efforts for COVID-19 containment practices. And she's now looking at this in comparative perspective with other OECD countries. So thank you so much for joining us. We're also very excited to have with us three other speakers. These are Dr. Ali Chima, who is the director of the Mehboob ul Haq Research Center, based at the Lahore University of Management Sciences in Pakistan. He is the founding member and current research fellow at the Center of Economic Research in Pakistan, and a senior research fellow at the Institute of Development and Economic Alternatives. We have with us also Dr. Marcos Nobre, who is a professor of philosophy at Universidad de Campinas, UNICAMP, in Sao Paulo, and also director of the Brazilian Center for Analysis and Planning, SEBRAP, which is a long-standing IDS partner in Brazil. And finally, we have with us Dr. Graham Smith, who is professor of politics and director of the Center for the Study of Democracy at the University of Westminster in the UK. I'm at the bottom of the screen is the IDS Twitter handle, and do please use that to tweet about the event today. So I'm going to run the conversation today, facilitate the conversation today through a series of 3 questions that I'll pose to our panelists. The first of these questions draws on the fact that COVID-19 has occurred in a context in which the research was telling us that levels of institutional trust were in decline. Whether or not that's actually true of most of the world remains to be seen. There's some debate around that, but there are two things that we understand quite well. One is that institutional trust matters, and it matters in particular for epidemic control. And the reasons for that is that institutional trust is about citizen perspectives on on state legitimacy and on processes of fairness, transparency, and efficiency in state decision making. And it's also about the extent to which people are able to trust the decisions that are made by these institutions for their lives. So it has a lot to do with compliance levels and the extent to which people are willing to comply with messages that they're receiving from the state, and which is, of course, of primary interest at a time like this. The second thing that we understand very well is that institutional trust is essentially a responsive phenomena. It responds to events. And the main event that I'm interested in exploring with our panelists today is that of decision-making processes by state institutions. So my first question to our panelists, and I'd like to invite them to speak in turn to this question, is the extent is to ask about what has been the process of decision-making around public health during the pandemic. And I'd like to call first on Yi, on Dr. Chai, to answer this by asking her to speak in particular to community engagement in the process of decision-making.
Thank you. Yes, we focus on like the study of community engagement in China because it's the grassroots institution levels to make the decisions, because there is different levels of states here, and then it depends on which kind of decisions made by different levels of states. So the community levels will make decisions to like regulate people's behavior. For example, they have how to make decisions to make people stay home, to wear face masks, to participate as volunteers, and to like communicate, to deliver informations from the like community workers to the residents. This all implemented by the community level. And also there are very huge differences between the rural communities and the urban communities, and also between different residential communities, because each communities may live in different populations. Some of our retirement communities, there are a lot of old people living there, and then they cannot use smartphone, and they can have the very basic skills to because we use a lot of internet to like deliver information, to online shopping, to do the internet medical services if they cannot go to hospitals. So we have to think about how to make decisions to meet different people's demands with different demographic or socioeconomic character differences.
Thank you for that, Yi. Can I ask Graham to come in next on that question?
Yeah. Hi there. Thanks very much for the invitation. I think the area we've seen most participation in is in relation to sort of mutual aid groups, local groups taking on roles in terms of helping people during the lockdown. But the sort of actual political decision making has been in this country has been highly centralized. It's been highly centralized to a small group of ministers and their political aides, and to the expert committees that have been established, which they consult with. And what we've seen actually, I mean, it was initially quite a slow response, but once lockdown happened, they actually had a relatively high degree of support. And we might explore why that's the case. It could be about sort of rallying around the flag type arguments or about particular political salience, but certainly people's approval of government action and I guess questions of trust went up. Unfortunately, as cases have started to increase again now, we're starting to see less confidence in government. That could be for a whole series of reasons, again, which we might explore later. One is sort of a confusion in messaging, as there's this desire to protect public health and to see the economy revitalize, and those sort of things, those have been in tension with each other. In the UK, we've also got devolved nations. So Scotland and Wales have been messaging in a different way from the UK government. We've seen a few members of the political elite stretching the rules or even breaking the rules at various points, which again has hit public confidence. We also saw quite a significant exam fiasco where it wasn't sure how students were going to be graded for about a week. And what happens is, I think, that sort of has fed into a sort of view of competence of the government, and their test and trace hasn't been working as well as promised. In the last 2 or 3 days, it's become clear that we're going to have more localized lockdowns or more localized action. It's quite telling that we've now seen local political leaders actually coming out and openly criticizing government for their approach. And I think that's all part of this kind of tendency towards centralization. The test and trace has been centralized, government decision-making has been centralized, the exams questions were highly centralized. And now we're sort of seeing a resurgence at the moment of local political leaders saying we need to be much more involved in this process. So it's a really interesting and sort of fluid situation at the moment.
Thank you. And you've picked up on something that you also referred to in terms of sort of the centralization that we'll pick up on slightly later in the discussion. Marcus, could I ask you to speak next to this question?
Yes, thank you, Chandana, and thanks for the invitation. Thanks, IDS, for the opportunity of bringing CBRAPS, my research center, into this discussion. Much of the data and analysis that I bring today comes from the Solidary Research Network that was built by the end of March in Brazil, and that congregates multidisciplinary and multi-institutional researchers, like over 100 voluntary researchers. So I think we should distinguish between, to answer your question, between state initiatives and society and social and societal initiatives. This is particularly important in Brazil because the federal government just refused to take a coordinating position. And this is a real problem when you have a federal government. So as in the case of the decision-making processes, also political is the institutional trust. It has been politicized too. So how can we qualify this politicization? I would say that there is an anti-system impulse that elected the present president of the Republic of Brazil, and he remains anti-system. So it's an anti-established government, if someone can understand this. What happened with this? The logic of the Bolsonaro's, the Brazilian president, anti-system tactics was to say that the system was the other levels of government, like states and cities and municipalities, so governors and mayors. So they are the system, they are the evil. But the paradox is that this pandemic requires more system and not less system in order to face it. So in the case of the pandemic, we had this coordinating problem in which states and municipalities were fighting for resources, were fighting for medical supplies, while the federal government didn't give the states and the municipalities the conditions to fight the pandemic. So on the one hand, states and municipalities depend on federal government. On the other hand, the federal government refuses to take a coordinating position. So what you have is confusion. And confusion is what the federal government in Brazil wanted to produce. And the president of Brazil has achieved this by simply saying that economy was much more important than the virus, saying that the virus was just a flu like any other one. And this situation of extreme confusion on the one hand and of extreme dependence on federal government on the other hand is the situation in Brazil more broadly, generally speaking. So we can specify this later.
Again, you've picked up on a few points that we'll definitely return to in a second. Ali, could I ask you to speak next to the question?
Yeah, so I think the situation in Pakistan has been much more similar to the UK, but it has kind of elements of the points that were raised about China and about Brazil, because Pakistan is a federal polity. So decision making has been highly centralized, but there had to be coordinating mechanisms that were put in place because the federal government has certain roles in terms of getting money for testing available, to get test kits procured and delivered to different provinces, guidelines. But then in terms of actually ensuring that all that was delivered through hospitals and doctors, and to ensure that the policing around lockdowns happened effectively and in a coordinated fashion, that becomes the responsibility of provincial governments. And we have a fairly polarized polity. We have the Pakistan Tehreek-e-Insaf, led by the Prime Minister Imran Khan, in power at the federal government level, and his party has control over 2 provinces. Well, actually, in coalition, it has control over 3 provinces, but then the province of Sindh is governed by the Pakistan People's Party, which is an opposition party, and there is a lot of polarization amongst these parties. The federal government formed with a handful of a lead in parliament. So the other big party, the PMLN, is also important as a parliamentary partner. But in spite of these kind of political divisions, what we have seen, again, like the UK after a bit of a kind of rocky start, that actually the coordinating institutions that could enable the centralized structure up pretty fast. So, the federal government set up what's called the NCOC, which is a centralized command structure, which has participation from all the provinces, and it is kind of chaired by the Minister of Planning and the health advisor to the Prime Minister. And it has kind of also participation from all the major institutions of the country. And they were initially able to devise a structure of communication. I think the divisions, the challenges that we have seen in Pakistan, although it's important to recognize that the context is a bit different to many other countries, because we had a spike basically between end of May, well, between April and June, but things have really, I mean, the infection rates and the incidence level has really come down from July. We don't know as yet whether that was because of effective governance and effective control, or there are other kind of unobserved factors that were causing these differences. But the big challenges that we saw were differences in policy. There was a time when the provincial and about the potential of basically the infection rates escalating, and they wanted a more severe lockdown than the federal government, which wanted a more liberal policy. So that's been a big challenge, but I think in recent days, the messaging has been more consistent. The second thing, which again, I think goes back to what Graham was saying, that it is becoming pretty clear, particularly at Pakistan's level of sort of infection positivity rates, that, severe shutdowns are simply not going to be effective solutions. So we've had to open, we have opened up, but with opening up, there is a need for localized control, right? And that's kind of coming up in the week that we're speaking. And over there, the big challenge is that when you come down to bits of cities or bits of rural areas, then there is a vacuum over there to have an institutional structure that can work with the province and that can work with the federal government to create the conditions to ensure compliance. So what happens is that in the absence of those democratic setups or the democratic institutions, the task falls to the police service. Adversarial and draconian for some people. And the way the state reacts is that it actually then doesn't want to enforce those micro lockdowns, as it were, because they think that that's going to lead to a lot of pushback and agitation. And then the kind of micro lockdown strategy sort of fizzles out. So I think that the thing that Dr. Chai started with about sort of having those grassroots institutions which can interface with the state, I think that's certainly a potential area of challenge that I see that we need to think about as it coming out of the Pakistan experience.
So that's actually really the point that I'd like to push on further. My second question, and around which I was hoping we could develop a little bit of a conversation, so please do put up your hand and jump in, the panelists, whenever you'd like. My second question essentially then draws on everything you've just said to ask, do you think this has an impact on levels of institutional trust? So we've seen governments do some things very well in terms of being able to control in some parts, but we've seen lots of problems with decision-making processes. We've seen problems around inconsistency. And some of the things that you mentioned are absolutely central to this. And so I want to draw you a little bit more on some of those points, but ask you to also connect that to what you think is the effect on institutional trust and to the relationship between governments and people. So one of something that you've all mentioned, two things in particular. One is this issue of coordination between centralized decision-making and where that decision essentially needs to be implemented, whether it is provincial governors or local governments or frontline workers, and that issue with coordination. And second, sort of connected to that, is the issue of inconsistent messaging. So if I could ask you to draw that out a little bit more in terms of some examples around where these tensions are most visible and how you think that then affects levels of institutional trust further. So maybe we can start with Dr. Chai again and have others, Yi, start with you and then have others come in on that.
Yeah. So at the first time when during the very early stage in Wuhan, so we also have very few informations about the outbreak, and then we get informations online or social medias or other wells. And then when the government started to host the daily press by the state council, and they will update the timely informations every day. And there are a group of people there. Some of them are these officers from the central government, and some of them are scientists. They are public health professionals. And then people can see the government is responsible for delivering information, and also the informations are scientific based, evidence based. So this can make people to trust the institutions. And then at the very beginning, because they don't trust the information delivered, because we don't have enough information. So then the trust is getting back soon. And also when we can also see at the very early stage, the government started to invest huge monies to establish two new hospitals for accepting patients. Actually, Wuhan is the city has a lot of health resources in China. We can be the top 3 cities having health resources. We have a lot of 3-tier hospitals, and but the government still invested like billions RMB to establish 2 new hospitals. This is very, and also the construction process is sharing online, and then people in Wuhan can see, oh, we have resources, health resources soon, and this can give people confidence, because that time is very, very, make people very panic. So this can give people a lot of confidence to trust the government, and then they will not hurried to go to hospitals if they just have some like general flu or fevers or something else. So, and this is also the other things. And also there are a lot of resources and ministries to announce they can provide resources. For example, the Ministry of Finance, they promised that they will invest how much money to for the containment, and also the National Healthcare Security Bureau announced that all the health costs will be covered by the government, and they will say we can spend. And that all the health costs will be covered 100%. And we can see there are some patients who aged over 80 and they spend over 1 million RMB, and which is more than 50 times of the average inpatient cost of COVID-19 patients. And all these costs have been covered by the government. So the people have this confidence to don't worry about they will maybe get poverty back because of the COVID-19. And also they promise we will give you rehabilitations during after discharged. And also there is, I wanted to emphasize one thing is we talk about the trust of the public on the institutions, and that we also need to think about the institutions or the government should have the trust on the public, because we trust the public, and then we are confident to implement some policies or containment strategies. Like we ask people staying home, we ask people wearing masks, and even during the period of the PPE shortage, we still ask people wearing masks if you don't have masks and you stay home. So I think this is all the other point that we have to think about the we contrast between the institution and the public.
Really interesting point, and I'm wondering if anybody else would like to pick up on that. I really want to sort of get into also the inconsistencies that you were talking about as well, is how the inconsistency in messaging affects trust levels. So that. Yeah.
I can go on this in the case of Brazil. So conflicting information and disinformation was one of the main problems in Brazil, because the monitoring panel we have with community leaders of this Solidarity Research Network has established that the first worry is hunger, and the second one is information. We know that science is slower than the virus, and it's difficult to message, it's difficult to inform about it because we know so little also. And when you come with disinformation, like the federal government came, so that conflicted with the WHO guidelines and scientific guidelines more broadly. And then people in the communities, they didn't know what to do. They didn't know why they should wash their hands, and they don't have access to water. So this conflict was used in a political way. So when you think about institutional trust. First, as you said, Chandana, people don't trust the institutions. They just use them as they come to them. And if the institutions don't come to them, they organize themselves. So if you introduce confusion in this means that there is no winner politically. And this political strategy has paid off. So the polls say that the federal government is seen by the population as, by 15% of the population as responsible. As for state level, 60%. And the rest by municipalities. And we have municipal elections in a month. So it's all mixed up in Brazil. And institutional trust is like, yes, we are very proud that we have an universal health system, the unified health system in Brazil. At the same time, we don't have the infrastructure for such a pandemic. So when people have access to the health system, they say, well, this was done by someone, by the federal government, for instance, but it's not done by the mayor or by the government. And this kind of confusion and this kind of disinformation was the main reason why we have over 150,000 deaths in Brazil the last weekend. So just to join this question about institutional trust.
Marcos, can I just push you a little bit on that? Because Brazil is a federated system and governors actually have a lot of decision-making power. And I'm just wondering whether that institutional trust equation that we're talking about is necessarily vis-a-vis the center, or whether we're also talking about the states in this.
It's a federal system, but it's different from the US, for instance. The kind of autonomy that states have is not the same as in the US. And they don't have the means for economic aid, for instance. They depend on federal government. They don't have the means to expand the health system without the federal system, without the federal government. So you have a situation in which the federal government is against the governors who are following WHO guidelines, and at the same time, those governors, they depend on the Ministry of Health in order to have more equipment. And we had 3 different ministries of health during the pandemic. And the last one was confirmed after 4 months of an interim period. And he is a 4-star general that confessed he had no experience whatsoever with health issues before he was put in the ministry.
These are all issues that are very familiar to the context in Pakistan. So Ali, I'm wondering if you can comment on that coordination, especially when parties at the center and in the province are from different, are different. Yeah.
Let me come back to the initial point that you raised about looking at it through the lens of institutional trust. And I think we have to be a bit cautious because, you know, as I was kind of listening to that question, you know, the thing that came into my mind is what's the kind of model that we have in mind? And I think if the model is that, you know, you have citizens, states know what to do, and that citizens need to be made compliant with the right kind of messaging, and all you need is the trust level to be there and things will work fine. I think that's too simplistic. I think what we have to recognize is that this was a situation where society was going to be truly polarized about which direction things went into. Now, in the Pakistani context, and this may kind of resonate with perhaps, well, this is kind of, I think, where Pakistan may be exceptional in this panel, is that, you know, we have essentially a system where you have you got a shock, and markets were going to be very ineffective ways of. So the employability shock and the earning shock was huge. We've been running both at the Center of Economic Research in Pakistan and at Ideas, these phone surveys. And what the initial information that we're getting is that during the period of lockdowns, almost 60% of people lost a significant part of their income. So they didn't lose jobs, a much smaller amount lost jobs, but they actually lost nominal incomes. We're not talking about real incomes here, right? Now, these people don't have any mechanism of social insurance, and their rights actually of employment are very precarious, right? And that's the neoliberalization of the economy, which has kind of pushed back on workers' rights. So the shock is actually a dual shock of both employment and income and of public health. And I think what's happened is functional economic view go into one direction. And then I think that the epidemiologists and the WHO also didn't help, because they came up with these incredible numbers about what death rates are going to look like. But as things are panning out, we know that there's far greater variation in what's happened than was what was predicted, right? So you got the whole system stuck in two extreme positions, right? And at the bottom, society was also struck in extreme positions. Once only two things that are there are, either we go for a full lockdown or we go for full opening up. Then, imagine I'm the person who's just suffered this massive earnings shock. My rights to employment are precarious. So society is also going to get massively polarized. So in preparation for this, I was just looking at sort of just responses to questions about, and what I'm finding in these surveys is it's highly polarized, basically. I mean, there are a lot of people who say that they trust the government, and then there are even amounts who say they don't, and there's a small proportion which is saying neither. And that, to me, may map out quite nicely about what the challenges were. At the end of the day, whatever was going to happen was going to be about a balancing act of these priorities. And I think where all countries have failed, and perhaps Pakistan may have failed, but somehow the thing sort of just getting managed because of kind of external factors and some good governance has brought it under control. So it's not been as severe, but the way out was to balance these two things. And balancing basically required that you had to have a learning system in governments which could actually track what was happening, and an effective communication infrastructure at a fairly localized level to actually coordinate that. And centralized responses don't actually allow that to happen. So they push you towards centralized lockdowns for an administrator. And I think that's what causes both ineffective responses, because the government simply doesn't have the institutional infrastructure and the learning infrastructure to track this and implement this and get consent in all of this. And you're kind of going to rattle around these polarized opposite ideologies, which are very extreme in the cost that they impose.
I think there's lots to say to that from the UK context, for sure, Graham.
Yeah, I mean, yeah, absolutely. I think that I agree with what's been said already in the sense that a lot of what's happening is actually really exposing existing dysfunctionalities of the state in different, what's happening in Brazil, what's happening in Pakistan, and even what's happening in China. And certainly in the UK, we can trace a lot of the issues I think that we're facing at the moment to our inability over the last few decades to deal with this question about centralisation and devolution, and the relationship of the UK state to, for example, to Scotland and Wales, which have autonomy in areas of public health. In our sort of the way that we've really diminished local government as an actor within our political system. It's really striking how many local government leaders say that the first that they hear, they only hear minutes before what the government's going to decide about their area. So they're not in the decision-making process at all. And alongside that, the sort of tendency within the UK to prefer a private sector solution to working with public bodies, with other local authorities. So we've got this kind of centralisation and privatisation thing happening. And I think early on with test and trace, a lot of those early mistakes were, we're going to do this through the private sector rather than thinking, actually, we've got this local infrastructure that we could be using. I think the other thing that we're facing at the moment, again, it speaks to what Ali just said, and I think speaks to actually what Marcos was saying as well, is the fact that we've got, there is clearly with all of these things, there's a politicization going on as well. And this is actually becoming much more a debate within the Conservative Party about whether you prioritize the economy, you prioritize public health, and about it's getting tied up as much within party politics as it is within the capacity of state institutions to act. And I think we need to kind of separate those two things out. The last thing I would say about the question of trust is an interesting one. Partly because I'm not quite sure that, for example, in a well-functioning democracy, you actually want citizens to be vigilant and not too trusting anyway, for in order that governments actually work in the way that, work in a responsive way, that they're motivated to act well. We've certainly seen this sort of spike as governments have acted of positivity towards the government, of sort of high rates of approval, but certainly across OECD countries where the data is richer, we've certainly seen higher levels of approval being sustained where there are lower death rates, where there have been capacity of government to act. So Germany and Norway stick out. Whereas in those areas with higher death rates, that approval rating has dropped quite quickly. And we're talking about USA, France, UK, Spain, those kind of countries. I'm not quite sure whether political trust should be understood as political trust, because that's about approval of government actions. So, trust gets caught up with assessments of performance. And the last thing I'll say, it also gets caught up with other policy disasters. So, for example, in the UK, as I mentioned, we had a terrible situation around the provision of exam results. And that got completely tied up with that became the sort of the sort of beacon for government performance at that moment. So everything else got seen through that particular practice. So the thing is, governments have got a real problem here. They screw up in one area, it's going to really affect other areas. I mean, in the UK, they're screwing up in quite a few areas. So there's a kind of pattern here. But I think that's a real importance for understanding sort of judgments of competence of government, because one area can often knock over into other areas. Sorry, that was a lot of things I threw out then, sorry.
No, but you pointed out very helpfully the fact that this is a very complex phenomena, and less so in the case of China, but for Brazil and the UK and Pakistan, it's so completely tied in with the polarization that you've all talked to. And I'm wondering if you can just speak to that a little bit more in response also to my third question, which is essentially, given everything that you've set out, what really is the way forward for governments now, or for community level responses, or for people in order of sort of, strengthening maybe in some way the relationship between states and people at this incredibly critical juncture? So we're thinking of COVID-19 as this moment in which these relationships may get written in very sort of indelible, in quite strong ways. And we're just wondering about what then, given everything you've just referred to, is the way forward from here, and what is it that we should really be keeping an eye on? Graham, you can start on that if you'd like. Yeah.
Oh gosh, my wish list. There's so many things. I mean, first of all, I think a more effective integration of other actors into political decision making. So it's amazing that local voices, as in local government, let's start off with local government, are not brought into the decision making. That is, as I've stressed several times, highly centralized. So that would be one part, would be integrating local government and actually building the capacity of local government to act, because, you know, the tendency, as I say, is for resources to become centralized as well. The other thing that I would like to see, and it's part of the sort of program of work I'm involved in with an organization called, a participation charity called Involve in the UK. We're raising this question about what does a democratic response to COVID look like? And we've got several reasons for thinking that, well, actually we need to have a much more participatory response to participatory and deliberative response to COVID. The tendency initially, and still now, is this kind of idea of we're all in this together, of COVID being the great leveler. But actually, the more we understand, the more we see actually it really creates enormous inequalities in terms of who's most vulnerable to COVID, inequalities in terms of who has to continue working during COVID, who has to expose themselves through their work, inequalities of people actually being able to survive in terms of physical health and in terms of mental health. And so it's not just about suppressing COVID, it's also about responsiveness of other services that go alongside that. And I think government is really poor at understanding the lived experiences. And I think we need much more subtle and nuanced ways of engaging different communities who are suffering in very different ways during the COVID crisis. The idea that there is a single response that is universally applicable is a real mistake. You know, we really need to be much subtler in that. And I think what this is exposing is the failures of not developing a kind of infrastructure of engagement with different sectors, with different social groups within society. So my two calls would be to sort of bring local government into the decision-making process. What Ali said, I think, you know, getting a better learning system in place here. And the second, and part of that would be to say, actually, even just engaging local government isn't enough. This actually needs to engage social groups and representatives of social groups and public engagement in a way that actually we're a much smarter, responsive, and hopefully, I guess, more trustworthy system.
Yeah. Ali, do you want to speak to what these learning processes might look like moving forward?
Basically, I mean, you know, at least what we've seen in Pakistan is that it wasn't sort of that the surge was happening everywhere at the same rate. So there are kind of huge variations, and when you're dealing with a large working class population which really doesn't have either private or public social insurance to provide it a safeguard against sort of employment and earnings shocks. The cost of actually locking things down can be huge, basically. And in that case, you really want to know, you know, what are localities which do kind of more stringent action, lockdown, or where you intensify testing to see how surges are going to happen. And all that kind of infrastructure is actually missing. And that kind of starts with the most basic thing, which is, you know, we don't really, you know, Marcos talked about a universal health system. Pakistan does not have a universal health system, but it also doesn't have an effective system that can do the reporting. For example, you get aggregate hospital information at the level of cities, but within the hospitals, you can't use hospital data to predict basically where the bulk of the cases within the city are showing up from, right? Or what the attributes of the people are, so that you can start to see patterns, right? I'm going to talk a little bit about the capabilities of government, which we shouldn't underestimate. So I think that's one thing that's missing. You have to develop that information system that will really allow you to reduce the starkness of the trade-off between the economy and the healthcare response that you need. But the issue is to do that through policing is going to be a big challenge. And I think trust levels really trust levels really fall if, rather than way to get consent or compliance through consent. And to do that, you have to have some institutional mechanism, which can't be, I mean, the state level is just too high. As you know, in Pakistan, we're a lot more like the UK regional governments, because in fact, more empowered in some sense in terms of the functions that provincial governments carry. But even the city level, I think, may be too high. So you want to have kind of almost organizations at the neighborhood level which could actually stream in. But the second thing is that the capability of the government is that through using technology, we were able to put in place a very effective tracing and quarantining system. We kind of also, within a period of a month, the government put down a very effective community testing system, and they tested almost 10,000 people in the city of Lahore, which has 1 million people, and were able to show these micro patterns. But these were centralized special responses. They're not institutionalized or built into the system. And I think the evolution of the public health response has to be there. And because the capability is there, but creating the capacity can't be a one-off thing, right? That just is going to make you too slow to respond to the nature of such crises. The second thing I think is where we were completely vulnerable, and Pakistanis have a great belief in God, in Allah, and it seems that he certainly is kicked in over here, which is we had roughly some 1,000 ICU facilities to increase it, but the number of beds that we had were very, very small. I mean, in terms of as a proportion of the population. So if there was a national spike that required something like 10,000 people to be dealt with by critical care units at a point in time, uh, I think we would have been turning people away from hospitals. And I'm talking about public and private hospitals. So the capacity of is non-existent. And I think that's a decision about how we want to spend our public finances, and do we want to continue to be a very low tax, open economy, or do we want to actually have a bigger role for public finances around healthcare? I think those would be, for me, the major challenges.
So quite major systemic things that we're talking about here. Yi, I was wondering if you could speak a little bit more in sort of wrapping this up to what Ali just said about institutionalizing the public health responses, and what sorts of elements are we talking about there? I mean, that's been a major part of your research.
Yeah, and we talk about the Graham's like the local government's capacity building, and we also like figure, because this time in Wuhan we have a rapid knockdown, so the outbreak is not spreading. And at the beginning there are a lot of critics on the Wuhan government, and then when we analyzed the governance capacities of the local government, and we say like, if this outbreak has happened in any city of China or any provinces in China, maybe their responses are the same. They also have the shortages. They cannot respond very well for this first time, because of the new emerging infectious disease outbreak. So, but we think we have a kind of a good response for the whole outbreak, and we provide a lot of emergency and inpatient care to the infectious patients. But actually, and also when during this time, we wanted to have a lot of plans to develop China's public health emergency system. And we can see is that there are a lot of resources invested, but most of resources may be not allocated at the right places. And some of the resources are allocated to expand more hospitals. We are not expected the outbreak again. We expected to prevent the outbreak. So we may invest more resources to develop the public health systems. And also there are a lot of, we wanted to develop the public health capacity. So many universities are started to develop or establish new public health schools. And we'll have to think about, is there are enough quantity faculties here, and how, because of the career system for the public health professionals is not attractive. So we cannot have a lot of PhD students with epidemiology or biostatistics who would like to working in the China CDC. So we cannot do many like high level like technical things for the public health responses. And how we develop this working environment for the future public health professionals is also the thing we have to think about it. And there is other things we think is also very important to make the local government to notice that this time is, as we may contain the outbreak very quick, and we still have a lot of like issues to develop the public health system and the public health capacity building. So I hope because the SARS was outbreak 17 years ago, and there are a lot of initiatives and actions we would like to develop, but 17 years later, it still has problem here, still outbreak, and how we can like remember this hurt, and we will keep working on that. It's an issue. It's not just one time, and then 1 or 2 years we forget about it, and then the things is still being like this.
And therefore the need to learn from this and to have those learning systems in place that's been mentioned before as well. Marcos, what's the way forward in Brazil?
Yes, first picking up on everybody's answers, I would say that the populist narrative has won in Brazil. First, by saying that this is a natural disaster. So the president of Brazil has convinced a large part of the population that this is a natural disaster. So the consequence is that in a natural disaster, if you have to choose between the economy and health, so you should choose economy. So as Ali said, there is a huge economic problem and hunger and everything. So this is my first point. The second would be that I think that Graham summarized what I wanted to say by saying, I don't know if I will really get to your words, but in a democracy, political mistrust is the condition for institutional trust. So this is the way I would phrase it. And also to say that coordination doesn't mean imposing a single solution. This is not the same. Quite the contrary. If you look what Ali said, there are huge regional differences. So we have just to share a system of information that allows us to coordinate actions and to give the actors autonomy. That's one thing we don't have now, and we should have. On state level, I would say, but also in the level of civil society, because when the state was not present, civil society in Brazil organized itself. And this is beautiful to see how many different solidarity networks were created. And we could institutionalize these networks now. We have municipal elections. We should look at that. And also, in the sense of efficiency, like E said, we have to look at these experiences as experiences that are efficient. With little resources, you can get much done. So I would say that the institution of, to wrap up and see the future, the institution of some basic income policy and or strengthening the existing policies to institutionalize these self-organized networks that are functioning very well without the state. Brazil has to help small businesses because they are also like the jobs that people have, many people have, and I see that in Pakistan too. And also I would say testing, because Brazil hasn't tested. To maintain the infrastructure, the medical infrastructure we achieved through this pandemic. And last but not least, I would like also to keep Brazil as a democratic country. I hope we can face this pandemic with democracy.
Fingers crossed, yes, we're with you on that one. But thank you so much for these very, very helpful comments. We're going to use the remaining 20 minutes to go to our audience, some of whom are on Zoom with us and others who are on YouTube. And those on Zoom can use the chat function to post their questions, or you can raise your hand and I will call on you to ask the question, and those on YouTube can post in the comments box, which we are also collecting, and we'll ask these questions for you. We'll pose them to the panelists. We have one question that's come through, and this is from Masuma Faruqi, and this connects very closely, Marcos, to what you just said and to something we've been examining around polarization. And this question is, what have been your country's experiences with those who don't believe that this virus actually exists? And does government trust have a role to play in that? And I think she's going back to the fact of polarization and the extent to which certain messages from the state have been received in certain ways by different parts of the population, and certainly around the wearing of masks and other containment policies. So can I pose this to you? Is why I guess in a sense, why do you think that this has also been a responsive part of the population to the virus?
I think she's absolutely right. And we have difficulties with science, because science, to say that an invisible virus is causing some disease is already a challenge. And the second challenge is science is slow, and we don't know very much about this virus. That's the reality. So when populist leaders come in, they say, well, they don't know anything. They are just spreading this system information for you. They are trying to fool you. And this idea was very strong in Brazil, and it was led by the president of the republic. So if the president of the republic says, well, social distancing isn't really necessary, using masks is not really necessary, that this disease is just a cold, and things like that. So what you have, you have this strengthening of institutional mistrust that he is trying to enforce, that he is trying to spread among the population. And this corresponds to what the population feels. So you have this confusing situation. And I think that she's completely right. So populist leaders, they came into the right moment with the pandemic.
Yeah. Graham, yes, please.
So I just want to follow on from what Marcos just said, and I think this raises an interesting question for what we were talking about in terms of trust. and polarization. Because if we think about Brazil or we think about the United States, there's a high level of trust amongst those sort of people who don't believe in the virus in the political leader. So there's trust in Trump, there's trust in Bolsonaro, but there's distrust in government, there's distrust in experts, there's a sort of a drop in systemic distrust as well. And so we have to really pull out where those different types of trust are happening, because clearly they are people who don't believe the virus is happening have trust in certain actors within the political system. So there's a real, it's really difficult to talk about, in inverted commas, institutional trust without recognizing these other ways that trust is playing out within particularly populist, those countries led by populist movements at the moment.
Shandana, can I come in on this as well?
Absolutely.
So I think that the Pakistan experience is actually quite interesting. That in the surveys that I've been looking at, basically trust in WHO and trust in doctors is really, really high. And in fact, Shandana and I are both part of this experiment that we're running, where we give people sort of information about different type of actors endorsing a future vaccine coming to Pakistan. And actually, secular actors do much better in terms of a trust response with the vaccine than non-secular actors. I'm suggesting this for two reasons. One, this is completely anomalous to the picture that is usually posed about Pakistan. But the second thing is, I think Graham was spot on, that we need to really unpack where kind of institutional trust resides. And the same surveys are showing that trust in elected representatives is quite low, right? So it's not that there's a monolith called the state or a leader and everybody trusts that. People can trust different parts of the system. I think the challenge in Pakistan is not that they don't trust the fact, and it's interesting, about 60% actually say that they're worried about COVID, even during a time when the infection was not spiking, right? So people have internalized this thing. They are the disbelievers, but I think that they're a vocal small minority here. But I think the problem in Pakistan, and we saw a similar kind of problem in Iran, is that social public events, religious events have a great sanctity for people. I don't think the issue is that they're thinking this virus does not happen. They're just willing to take a chance because they feel that they have an obligation. It's interesting, in these surveys, one of the big things is people say that they get a tremendous amount of social pressure to actually continue to meet, right, in families and so on. So we have to kind of also bring in the social fabric, and how does kind of isolation fit in? And again, I don't know what the right response is. Is it the right response to say, oh, break those social fabrics and isolate yourself, because then you're going to start to have mental health problems, as Graham was talking about? Or do we find some mechanisms to say how you can do this safely? I think we just haven't had a nuanced debate. And once you get polarized positions, people just move in extreme directions. It's about finding some center here.
And certainly in continuing the debates, we have lots of questions now. So I'm going to read one out from Alex Shankland, who's on the chat, but apparently not able to ask the question because of the functions that people here have available to them. But panelists can also look at the chat function, and there's quite a few really interesting questions there posed to you about the role of researchers and research in dealing with this moment of distrust between states and people. But let me read out Alex's question. He thinks this was a very fascinating contribution and would like to thank you all for your comments. Following up on Marcus's point about political mistrust and institutional trust, and this is a point that Dina Zaid has also asked about in her question, I wanted to ask what conclusions we can draw about tensions between trust in specific institutions and institutional trust understood as trust in a larger system. So where Brazil and Pakistan have given increased visibility to the military Is this part of a wider strategy to undermine the system of democratic, decentralized, deliberative decision-making, which could enable the institutionalization of local citizen engagement? And are there equivalent processes in the UK or in China, given the army's role in building hospitals as well as conflicts over scrutiny by parliament? To what extent are we seeing multiple attempts worldwide to use the pandemic response to promote the role of a small subset of institutions? So essentially pulling away from the democratic process in some sense. You would like to speak to that first?
I can go if you want. Just quickly to thank Alex for the comment, actually, and to say that we should have another panel just on specific institutions, not to think about institutional trust in general, like we did today, which is important, but to specify. So Ali has already specified, as he said, well, it depends on who or to where to you're looking. If you look at the military, why did Bolsonaro look at the military? Because the armed forces in Brazil, they have a very high degree of institutional trust. So they are like not corrupt. They are like, they do everything right. So that's why he militarized his government. And of course, with this, he's also trying to undermine democracy at the same time. And what he's saying is that, well, you know, the system is democracy. So science is democracy, WHO is democracy, so, and they are evil. So he has this equation between democracy and system evils. So in the long run, it's a real danger for Brazil. Because as Graham said, can democracy survive this pandemic? How can democracy respond to this pandemic in the way that you can have institutional mistrust, but you have trust in democracy at the same time? And we have conflicting positions to this moment, as Ali correctly pointed out. People are afraid of the virus. At the same time, they say, well, I have to take my chances. They may well be in favor of democracy, but at the same time, they want the government to do something. And to do something may be something authoritarian. So we have conflicting messages here. And as Ali said, the social fabric is very complex. And we need to go to the ground, I think, to see the things, how they are.
Okay. Graham, there's a question to you in there that I'm wondering if you've seen. There are many cases every day in the UK, while the public, young people in particular, seems against the government rules in various ways. Is it because the public do not trust the institution or government? Or does it seems like an overreaction to the COVID-19 threat? I'm wondering if I've got the sense of that right. I think you've spoken to that to quite an extent in your sort of finishing comments at the end, but I'm wondering if you want to pick up on that quickly.
Yeah, it's a difficult one to judge with it. I mean, it's hard being an academic in these situations, isn't it? Because we're used to like taking a lot of time to try and to develop our responses, and then you know these are immediate things. I mean, again, I think it's what Ali was saying and what others have been saying, which is that there's this sort of desire to do the right thing in relation to COVID, but there's also this desire to live your life as well. So, and I think it hasn't helped in this country with some of the really poor messaging that's happened, and some of the sort of, as I say, other areas of policy that have failed, because that just there's a lack of confidence. Well, if the political elite can't do this right, then why should I? So I mean, I think there is a lot of, and there's a tendency, particularly in the UK press, to start scapegoating. So there's a lot of scapegoating of young people at the moment, and that's an unfortunate practice. I just want to say something positive, because it's all very negative at the moment, is that for me, obviously I'm very concerned about the sort of over centralization that we're seeing, this tendency to sort of concentrate power, the kind of decision making with a small number of people. But I think actually what's happening is it's becoming more and more clear that that's dysfunctional. That doesn't mean that we're going to get things right now, but what it means is I think it actually is creating space for people to actually say there's something wrong with our governance systems. So I'm not saying that that's going to lead to a positive response right now, but it creates space for people to say there are other ways that we could be doing this. And I think in the UK at the moment, because local leaders are starting to be quite upfront and saying, look, we need to be much more involved in this process if you're going to really lock down our areas. We're starting to say, oh yeah, why isn't local government involved in this process? So it's exposing dysfunctionalities in a way that you don't see during in normal politics, everyday politics. So whenever you expose dysfunctionalities, you actually create space for other ways of doing things. Now, whether those other ways of doing things will succeed, I don't know, but it does create an interesting space for us politically.
That's a really interesting point. Because we're running out of time, I'm going to try and bring together these three questions that are quite closely related, and that's about the role that academia and researchers can actually play in this moment of mistrust or better communication processes. Does better communication have a role to play within this? And Peter Taylor, who's at IDS, asking whether researchers such as yourselves are interested in joining up efforts, if you think there's a role for researchers. And I was wondering if maybe Yi, you'd like to come in on that, because you've been looking at this and trying to use your research to think about public containment of the pandemic, strengthening containment practices.
Yeah, we during the lockdown time in Wuhan, we keep working with the frontline workers, health workers, and the government. So we also come to the Fangcheng Hospital to assess how its effectiveness, and we help them to develop the temporary hospital management to run their hospital efficiently and safely and effectively. So there are a group of people from different backgrounds to working together to develop these new hospitals. And also we submit our policy briefings to the government to introduce, to recommend them what they should do, what they should do this for that. So keep submitting policy briefings to do it, and some of them. And we have the university and the government has the track to submit these policy briefings to provide information. And also, even also after the lockdown, and also there are a lot of economics professors in economics to provide a suggestion to the government how to get the economy back. So we keep working for the governments and the communities.
Anyone else on that, on the role that research and academia can now play in this?
Yeah, I think that they're kind of, we need to know a lot more about, how the disease patterns worked. I think we came out with these fairly mechanical epi models initially with fairly, wild parameters as they're turning out. And one of the things is that they just can't explain the different experiences. So I think that's a challenge and I think their comparative work would help. Like, Punjab, the province I'm sitting in now, was divided at the time of partition. A part of it went to India, a part of it is in Pakistan. The experiences are diametrically opposite. I mean, while Pakistan has been, incidents fell and has been stable and low, India, it's just like gone out of control. Now, these are fairly similar climatic conditions. So what's the difference? Why is this happening? What happened? How much is it attributable to government action? How much is it to do with other factors that we just don't understand? I also think that another big question that I think came through this conversation is that there are going to be many kinds of inequalities that are going to get exacerbated as a result of COVID, which we just can't see. So for example, people who face income shocks, are they actually going to recover their income? I'm not sure. As the recovery happens, is the kind of growth in inflation going to impede that recovery? I think these become really, really important questions. And then I think that the questions about design, Marcos talked about basic income. I mean, how do we design social insurance, with the perception of pandemics? One thing should be clear, I think, by now is that when you have a pandemic shock, markets are not going to give you solutions, right? So there has to be some way of socializing that problem. And I think the big assault of the right has been the dismantling of the social insurance systems. So how do you create that system, and how do you build trust in welfare? Because I think unless we do that, our ability to really lower the kind of bite of the trade-offs is going to be very, very limited.
And that's connected in a way to this last set of questions that I'm going to pose, and apologies to everyone whose questions we were not able to get to. But in these last 2 minutes, there's been questions about the level of community response and community organizations responding at the grassroots level, and the extent to which that might take some of this pressure off the state, or the ways in which that might then affect institutional trust. Yi, you spoke to this right at the beginning when we first started this. This is exactly the note on which you started. So do you want to come in on that? The specific question is, does it let the government off the hook from providing the support that people need? And are these groups just doing the work that the state should be doing and for free? But also, how do you describe the level of public trust in such initiatives vis-a-vis the government-led ones? So any last comments on that? And then we'll stop this discussion there.
Yeah, these groups, actually, we encouraged everybody to contribute to do the services. But the first time the government asked the CPC members to working like the officers, they were like whatever the level of the governmental officers, like the provincial, in the Wuhan University, the highest level is the provincial level. So the provincial government officers also working in the communities for free to provide services, to working to do the public services, to like deliver food to the residents, everybody. And also there are a lot of, because we cannot go out for work, so there are a lot of young people working, staying at home. They go out to be volunteer. They organize the people in the community for the online shopping, for delivering medications, for providing like rides to people to go to hospitals, because the public transportations are shut down also. So all these people try to make efforts freely to contribute to make the cities back again.
Thank you. Any last comments from everyone else?
Just a quick question on a quick comment on that. I think there is a real tension here in the long term about how government and market responds to these kind of mutual aid developments. They've got a solid, very specific logic of solidarity, which comes into tension with a sort of bureaucratic logic and the market logic. And I think we don't have a very good history of sort of interfacing these kind of, building on these mutual aid. What tends to happen is they tend to get crowded out by government and market action as those institutions come back into the picture. So I think, there's clearly a lot of energy and a lot of activity, a lot of creativity here, but it's so easily undermined by government and market.
Thank you. Marcos.
Yes, thank you for this discussion. I think that as professional researchers, we have a duty to society at this time. And the first duty is to say, well, this pandemic will be with us for a long time. And we need research to understand what's going on. Also, in the community level, in the auto-organization level of society, in order to find good answers to this. And this duty that we have is also a multidisciplinary one. So for the first time, I see that human sciences and hard science and whatever, they are getting together for the first time in years and years and years, really, to address this crisis. And we should go together and say, this will be with us, and we need research for a good way of acting against this pandemic. That's what I would say as a final comment. Thank you.
Thank you. Ali?
I kind of agree with what Graham was saying. I think it's a big challenge, of course. In a lot of countries, the local government, an effective local government tier just doesn't exist. So the first question would be, how do we design that? And I think the second thing which we shouldn't forget is we're talking about federated systems. So they can't sort of exist independently. So we have to think through what the threads are that are going to join them. And I think information is an increasingly important thing, and collaborative decision-making forums. And I think the big challenge we saw in Pakistan was that the flow of information and those collaborative forums could get polarized, and information wouldn't be shared at times. And that kind of could put us at risk at times. So I think it's the design of the federation or the federating systems that I think is a common thread that runs from China on this panel through UK, Brazil, and all the way to Pakistan. And I think that becomes an important question for research as well.
And John Gaventas just commented to say that he's hoping that we'll continue to write about this, but we're also hoping to continue to chat across these countries, across different countries, in addressing the biggest challenges of our time. Thank you so much for joining us for this one, which like I said at the beginning, I'm hoping it will be the first of many conversations that we'll have across countries through the IDS hubs. Thank you everyone online for joining us. Thank you again to our panelists for such a rich discussion, and we'll see you at the next event. Bye everyone.
Thank you. Thanks.